Welcome to APRN Talks, where viewpoints are worth sharing. I'm your host, Lindsey, and in this episode, we'll be discussing how to navigate through ethical dilemmas that you may face in your nursing practice. Our case study today revolves around the central issue of honesty versus withholding information. But before we get into the case, let's first discuss the dynamics influencing the bioethical dilemma of honesty versus withholding information, as we are reviewing ethical issues emerging from medicine. Honesty is an important element of practicing the fair use of power by showing trustworthiness, acting with integrity, telling the truth, and avoiding deception. When we communicate as a nurse practitioner, honesty is an ethical principle. It is critical to developing trust and respect with our patients. If a patient places a great deal of trust in us and that trust is broken, they may perceive that lack of honesty and not trust us any longer. Yet there are situations in which the truth can be said too harshly or may be needed in times of crisis. It creates a tension in providers' values, causing them to be inclined towards withholding information when a diagnosis may have a terrible impact on the patient's emotions. So, in an attempt to protect the patient, the provider creates a vagueness around the issues and conceals pertinent facts. Now that you understand the bioethical dilemma of honesty versus withholding information, we can move on to our case study. Our performers are the patient's daughter, Paula, the patient, Roberta, and the family nurse practitioner at a primary care center. We will imagine ourselves as if we were Tracy. So, let's go meet our primary case.
Well, good morning, ladies. How are you this morning?
Good morning. Good morning. Thank you, Tracy.
Nice to meet you. And you are?
I am Paula McGraw.
Hi, Paula. It's nice to meet you. I'm Tracy's. Nice to see you.
I'm sister. No, I'm daughter.
Your daughter. Okay, daughter. All right. So how are you feeling?
Oh, so better. You know, this shoulder was out of place, and they got it back in place. I'm 70 years old. I've never had a broken bone before, but these ribs are sore. My daughter keeps telling me to take pain pills, and they're doing much better, but that does make me tired. Mm-hmm. That car wreck was something else.
How's your pain? Is your pain under control?
The pain pills do keep it under control, and I sleep okay at night.
That's good. That's great to hear.
Yeah.
You do look awfully familiar.
I was going to say,
Have I seen you in the building before?
Yes, I'm a clinical psychologist up on their floor.
Okay, that makes sense. That's why you seem familiar to me.
Russian kids in the hallways.
Yes. Shall we get started on our appointment
Sure.
today?
Yeah.
Okay, well, the reason that we scheduled this appointment today is because I'd like to go over some results of an endometrial biopsy that just came in.
Did you say biopsy? I didn't even realize I'd had a biopsy. I guess I was out of it those first few days after the accident.
Well, after the accident, we needed to do a CT scan to check for internal injuries. And while they were doing the scan, they came across some things that we felt needed to be looked at.
Actually, could we step outside for just a minute? I wanted to have a few words with you, if that's okay. We'll be right back.
Well, now, Roberta, are you okay with this? Are you okay with me
Sure.
going out and talking to Paula?
Yeah, she's my power of attorney for healthcare, and I trust her 100%.
Okay, well, we'll be right back.
Okay.
Right, we'll be right back, Mom.
Okay.
Okay, I'm sorry. I am so worried about my mom and her mental health. I'm worried about what these test results are going to show us. I'm imagining her care. I'm her power of attorney. I want you to tell me first. Is it cancer, Tracy? Okay, well then I think I want to be the one to tell her when I feel she's ready. The pain pills are making her loopy and tired and forgetful. I want to spare her some needless worrying. It takes so long to make these oncologist and surgeon appointments. Why not wait and let me take care of those appointments and then we tell her? Her mom just passed away, my grandmother. I just don't think she's ready to handle this right now. And I want you to back me up on this. Tell me that you're not going to tell my mom her bad news today. I think I know her best. how to handle this.
How are we going to solve this dilemma? Well, we are going to use a 5-step process called the Baird decision model as an ethical framework for decision making. The first step includes being attentive. Before we take action, we must figure out what the situation is exactly going on and separate the facts from our assumptions. In the second step, we are intelligent and use critical thinking skills to identify the ethical issues and stakeholders affected by Tracy's decision. In the third step, we are reasonable and use Baird's 4 ethical lenses, or what I like to call ethical philosophies, or tools to process and gain an ethical perspective to reach a solution. In the fourth step, we are reasonable and select the course of action that we believe is the best ethical approach to reach the desired goal. In the fifth step, we are reflective and analyze the effectiveness of our decision and our reasoning. The first step is being attentive. We need to separate the fact from assumptions here. I've listed the facts and the assumptions, but is there an assumption that is a fact? I'll give you a clue. It's the last one. We need to check if there's validity to it. In 2018, the UW Medicine's medical history and ethics professor Braddock noted 90% of patients surveyed would want to be told of a diagnosis of cancer. Also, in the 1960s, 10% of doctors believed that it was correct to tell a patient of a fatal cancer diagnosis. In contrast, nowadays 97% of providers feel that such disclosure is the ethical decision. Lastly, what are the tensions in the ethical dilemma? Should Tracy follow her head and tell Roberta what the results are for the biopsy? Or should she follow her heart and be sympathetic to Paula's request? Tracy does work with Paula, who's a clinical psychologist, so Paula may be very knowledgeable about Roberta's well-being and mental state. Or does she decide to work independently? Does she collaborate with the family request or share the decision with Roberta and Paula? Catherine Baird's 4 lenses can be thought of as 4 ways to view a problem or formulate a philosophy to decide what behavior is ethical. The lenses or viewpoints may have a predominant lens, or a person can have a combination of many. The 2 lenses of responsibility and relationship both emphasize using rationality or critical thinking. If Tracy favored the responsibility lens, she would use reason, determination, and principles or rules by which she and others should live by. If Tracy favored relationship lens, she would use the mutual reasoning of her community to design and implement processes that protect and powerless and safeguard justice for all. The other 2 lenses of results and reputation are emphasizing the sensibility or intuition or emotions. If Tracy favored the results lens, she would use her feelings to determine the choices that would contribute to her happiness, as well as, by extension, the happiness of all those around her. Whereas if she favored the reputation lens, she would use her feelings and intuition, as well as traditions and wisdom of her community, to identify character traits that are required for a virtuous living by being a role model to emulate. Will Tracy prefer to critically think before she acts? Or will she jump into action and deal with the consequences later? These lenses are fundamental to how we, as Tracy, will make an ethical decision. Here we will consider Tracy favors predominantly the relationship lens. In the second step, we look closely at the 4 ethical philosophies or viewpoints of each lens before making a decision. Thinking of her responsibilities, Tracy may be inclined to want to fulfill her work requirements and uphold standard practice guidelines and regulations. Thinking of the results, she may want to promote positive win-win scenario where she is happy with the scenario and everybody wins, and she accepts the consequences that may come from that decision. Thinking of the relationship, she may want an equal and fair outcome to occur, where she gives a voice to those without power. Thinking of her reputation, she may want to embody a role model, leader, virtuous colleague. The second part of step 2, we divide stakeholders into primary and secondary groups before deciding what Tracy's ethical decision obligations are to each group. Secondary stakeholders noted here are not as close to the center of the issue. However, they may be slightly affected by Tracy's decision. Thus, the broader implications are within the secondary stakeholders. The individuals affected the most are the primary stakeholders listed here. In the third step, we need to be reasonable and look at the resources or tools that may prove helpful in guiding our perspective. We could use the 6 ethical principles pictured here, specifically honesty, as the patient deserves to know the whole truth about her illness. The patient and the doctor both have the right to dignity. Non-maleficence, we do not want to do any harm to our patient, and we want to promote justice for all. We act in the best interests of the patient, such as beneficence. And lastly, autonomy would allow the patient the right to choose her treatment. Another tool we could use is the 3rd step of professional standards. As nurses, we have our own code of ethics with 9 provisions written by the American Nurses Association. And the 2nd provision applies to this scenario, as we have to be committed to placing the patient's interests first. The 3rd tool that we could use are the ethical tests. According to an award-winning psychologist, Dr. Lacona notes the following 8 questions that can be applied to any ethical situation. The truth test. Are we going to tell the whole truth? Yes. The parent test. Our parents would approve. Or what advice would they give? Well, they would want us to be honest and true to ourselves. The golden rule test. Are we doing unto others as we would have done to us? The religion test. Can we apply our faith to this scenario? The what if everybody test. Would we want to live in a world where everybody follows this action? The consequence test. Are we going to regret this action? The front page test. Would we be okay if this was reported on our front page newspaper? And lastly, the conscience test. Does this go against our conscience? In step 4, we decide what to do and create an action plan of the best way to resolve the ethical dilemma based on Tracy's philosophy of the reputation lens. How will we reach beneficial results? Well, we have come to the conclusion that we should not confuse distress at giving or receiving bad news with justification for withholding the truth. Tracy decides that Roberta should be told about her diagnosis, prognosis, and treatment plans today. Tracy will fulfill her duties and embody her principles by seeking a shared decision process where she incorporates both Paula and Roberta's preferences to allow an equal opportunity for fair outcomes. Tracy will notify Paula, her mother, that she has uterine cancer and educate her why it is essential to tell Roberta the truth today. Tracy will also be considerate of Paula's request to be the one to tell Roberta the diagnosis. Tracy will not automatically jump into conclusions about what she should do for Roberta's rights. We always have to assess our patients first, and she will assess Roberta and want to know if she wants to know the full diagnosis or if she wants to have her daughter, her POA, take care of the treatment plan. In some cultures, patients prefer to abdicate their role in the treatment plan, and we must always respect our patient's preference. This will allow Roberta to have a voice in her plan and a cane and power. Lastly, we will display courage and become ethically motivated to translate our decision into action and respond to Paula's requests and concerns. Tracy has thoroughly and mentally prepared how she is going to respond to Paula. So let's go see how she does.
Paula, I really do appreciate your concerns, and I understand. But I really feel like the best thing that we can do for Roberta is to tell her the results of the biopsy today, because unfortunately, it is cancer, and we do need to get her the knowledge now so that she has time to adjust and soak it in before she meets with the oncologist that I'm going to refer her to today. And as for withholding it from her, I just feel like we cannot jeopardize that doctor-patient relationship with me not being honest and open with her about the situation and what's going on. So I really feel like we need to tell her today. Are you sure you want to be the one to tell her this information?
Yes, I feel I need to be the one to tell her. Then again, thank you for listening to me. I can see where you're coming from also. So you really think we have to tell her today?
We really need to tell her today. We need to get things rolling and again, give her the chance to be able to digest all this information we're going to give her. It's going to be a lot of stuff coming at her today.
Okay.
So I'm going to go speak to my nurse and give you a chance to get your thoughts together and then we'll go in and we'll talk to her about what's going on. Okay?
All right, thank you.
We get back here with you and we can go over the results of your test now, okay? I'd like to ask you a couple of questions first before we get started, okay?
Sure.
How do you like to handle your medical knowledge? Do you like all the details of your treatment?
Well, while you guys were out there talking, I couldn't hear you, but I was thinking, I do want to know what's going on. I want to know. I want to know everything.
Okay, well, thank you, Roberta, for answering me honestly with that thing. I'm afraid I don't have very good news for you today, as I discussed with your daughter already. So we would like to take a moment to talk your test results, but your daughter would like to be the one to tell you what the results are, okay?
Mom, when you were in the hospital, they did do the scan, okay? They found a concerning mass in your uterus, and they did do the biopsy procedure. I signed off on it because you were in so much pain, they had you medicated, and then I didn't tell you afterwards because I wanted to spare you extra worrying. Didn't want you to needlessly worry about it. But now that the results are back, we do need to talk.
Cancer?
You do have cancer, Mom. I am so sorry.
But you need to consider this car accident a blessing, because if we had not had to do that CAT scan, it might have been months or years before we discovered that you had this mass and that you had cancer. So this car accident was a blessing in disguise. It really was.
That young person that T-boned me, but they could be saving my life. Oh my goodness.
They could, because this is a very common cancer for women who are menopausal and postmenopausal. So it's very good that we were able to catch it at this time.
Can't believe it. I have cancer. You know, I did all my womanly checkups. I did my pap smears. I just don't understand it.
Unfortunately, despite all of our routine checkups, this happens. The cause is unknown and it's uncertain why some women get the cancer and others don't. But you've probably had it for a long time. And so now we're gonna do everything we can. Your family, myself and my clinic, we're gonna do everything we can to get things going in the right direction.
Okay. And I thank you both for telling me. I really appreciate it. It's just gonna take a while to process that I have cancer.
It does. It will, and that's okay. But can I go over the next steps with you?
You bet.
Okay,
I want
so
that.
the next thing that we need to do is we need to set you up an appointment with a medical oncologist that will go over all these things that they need to do. They'll look at the biopsy, they'll look at the stages, they'll figure out what treatment and things that you need, and they'll probably work with a general surgeon to put all of this together for you, okay? And they will also be able to decide then if it's they're gonna do take out all of your uterus, or they'll just take out part of it. They'll decide on the treatment, whether we use radiation or chemotherapy, but they'll make a plan to go from there, okay? But I do want you to know that our office here will also be working with them to do everything that we can to help you and your family in this situation to get through all of this.
Whew, okay. I don't have any other questions right now. I think I'm just in shock.
Well, I can't imagine what you're going through. I really can't. So I think we need to give you some time to think about this. How about, let me check my calendar here. How about we meet in 2 weeks on December 20th? Okay, that sounds good. And we will, same time, 9 o'clock, okay with you? That looks like that's working for me. Okay, and then that'll give you a chance for both of you to write down any questions you have and any concerns or anything that we can do to help you with that, and then we can go from there with scheduling and everything. But before we say goodbye, I want you to please tell me in your own words, Roberta, what have we been talking about today?
Okay, I do understand. I have uterine cancer. We got an appointment in 2 weeks, and Paula and I, if we have any questions, we can address them then, and she'll help me make all those appointments with you guys.
Okay, that's great. Now, please remember that we are here to offer any services that we can to help you through all of this. So at any time you feel the need, please call the office and ask the
Oh, I
questions you
will.
have, and we will do everything we can. The clinic is here to help support you, our staff, and we will do everything that we can to get you through all this.
Thank you for being there for us.
You are very welcome anytime.
Yes.
And
Okay.
again, it was nice to meet you. Sorry about the situation. Thank you. Thank you.
Now it's time to be reflective and deliberate or evaluate if Tracy made the right decisions, or if there's anything that could be improved upon so that we can learn and grow from this situation. Tracy feels she was able to embody her core values that are listed here. She offered the client focused, transparent, and honest care while being respectful of the family's wishes. Tracy next needs to reflect on the barriers that she perceived and overcame. There can be social, cultural, psychological, and practical barriers. Tracy imagined the reactions of Paula and Roberta and had a strong fear she may not know how to handle the emotional reactions. She also worried about being judged by her colleagues if she was making a mistake by letting Paula deliver the diagnosis. She broke through her perceived barriers and openly communicated her thoughts and assessed how each stakeholder felt regarding her decisions. Then we can start thinking of the what-ifs and run through potential scenarios that could have happened and how she would handle those scenarios in the future. For instance, if Paula had refused Tracy's decision, what would she do? She could tell the family that they would have a conference and give Roberta the voice to allow Paula to see what her decisions would want to be. Tracy also wonders if she may have shown some bias towards Paula in delivering the news. Would Tracy allow every one of her patients in the future to do this? Or did she just make an exemption for Paula because she knows her and is a clinical psychologist in her workplace? Now, fellow nurses, let's continue reflecting on the 5th step. Here I have listed 4 questions that you can reflect upon and answer in our discussion board this week. I look forward to hearing your feedback and discussing these further with you. Thank you for watching.